Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering Integumentary Part 2. Guys, if you haven't watched my Part 1 of the Integumentary system, make sure you watch it. It really doesn't go in any particular order, so you can watch this video first, but make sure you catch the first one because I cover a lot of very important information about the skin. All right, guys, so without any further ado, let's get started. First question. The nurse and an unlicensed assistive personnel are caring for clients in a dermatology clinic. Which task should not be delegated to the UAP? 1. Stock the rooms with equipment needed. 2. Weigh the clients and position the clients for examination. 3. Discuss the problems the client has experienced since the previous visit. Or 4. Take the biopsy specimens to the laboratory. And guys, the correct answer is 3. Discussing the problems the client experienced since the previous visit. So guys, unlicensed assistive personnel can do a lot of things. They can do vital signs, they can check glucose, they can transport equipment, they can transport medicine, they can take vital signs, they can take INOs, they can do a lot of things. They can remind patient whatever the nurse taught them. They can do a lot of things, but they cannot assess, they cannot evaluate, and they cannot teach, okay? So choice number 3, where you're discussing the problems, you're assessing, you're evaluating. That's not something that an unlicensed assistive personnel can do. But the other things they can do, they can stock the rooms with equipment, they can weigh the clients, and they can bring biopsy specimens to the laboratory. But what they cannot do is assess, evaluate, or teach. Okay, so the correct answer will be number 3. Next question. The client is admitted to the outpatient surgery center for removal of a malignant melanoma. Which assessment data indicates the lesion is a malignant melanoma? 1, the lesion is asymmetric and has irregular borders. 2, the lesion has a waxy appearance with pearl-like borders. 3, the lesion has a thickened and scaly appearance. Or 4, the lesion appeared as a thickened area after injury. And guys, the correct answer is 1, the lesion's asymmetrical and irregular. You should suspect possible skin cancer when you're looking at the lesion, and instead of being symmetrical, the same on both sides, it's asymmetrical. It's different on one side than the other, right? And the second part, the borders are irregular. So instead of those borders being uniform, those borders look irregular. So you should suspect possible skin cancer. Now let's look at our wrong answer choices. 2, the lesion has a waxy appearance and pearl-like borders. When you see waxy appearance and pearl-like borders, you need to be thinking basal cell carcinoma, okay? Choice 3, the lesion has a thickened and scaly appearance. Thickened and scaly, you better be thinking what? Squamous cell carcinoma. And lastly, lesion appeared, look at this, guys, thick after injury. What kind of lesions appear to be thickened after injury? Keloids. Right? So for this question, our answer is number 1. The client has the squamous cell carcinoma removed from the lip. Which discharge instruction should the nurse provide? 1, notify the doctor if a non-healing lesion develops around the mouth. 2, squamous cell carcinoma tumors do not metastasize. 3, limit foods to liquid or soft consistency for 1 month. Or 4, apply heat to the area for 20 minutes every 4 hours. And guys, the correct answer is 1, notify the doctor if a non-healing lesion develops around the mouth. First of all, let's stop at non-healing lesion. The minute you hear or see non-healing lesion, one of the first things that need to be going through your mind is cancer, right? Non-healing lesion. So go back to the question. It says the patient initially had squamous cell carcinoma removed from the lip. Why would we need to know if they now have a non-healing lesion that has now developed around the mouth? What are we thinking? It's metastasized. Okay, and when it comes to skin cancer, guys, especially squamous cell, it tends to met and grow around the oral mucous membrane. So that's very important. Now let's look at the wrong answer choices. 2, squamous cell carcinomas do not metastasize. Oh, yes, they do. Yes, they do. Choice 3, limit foods or soft consistencies to 1 month. Surgery was on the lip, not inside the mouth. You would want, you see this choice number 3 where you tell them, liquid or soft foods. That would have been if the patient had surgery inside of the mouth, but they didn't. It was on their lips, so that's not necessary. Choice 4, apply heat to the area for 20 minutes every 4 hours. What? For what? No. That's wrong. So the correct answer, we need to know if they develop a non-healing ulcer around the lip, because we know in the mouth, we know it tends to metastasize. But across the board, guys, we're going to tell them to let us know if they have a non-healing ulcer, because we're going to be thinking cancer. The male client diagnosed with AIDS states that he has developed purple brown spot on his calf. Which action should the nurse do first? 1, refer the client to the doctor for biopsy of the area. 2, assess the lesion for size, color, and symmetry. 3, discuss end-of-life decisions with the client. Or 4, report the sexually transmitted disease to the health department. Come on, you guys all know this one. So the correct answer is 2, you're going to assess. Remember the A, B, C, Ds of a skin cancer. You're going to look for asymmetry, you're going to look for the border, you're going to look for the color, you're going to look for the diameter, right? So the correct answer is 2. Then after you do that assessment, you suspect it's possibly cancer, you're going to refer them to the physician and so on. But the first thing you want to do is assess, look and ask questions. The nurse participating in a health fair is discussing malignant melanoma with a group of clients. Which information regarding the use of sunscreen is important to include? 1, sunscreens only needed during the hottest hours of the day. 2, toddlers should not have sunscreen applied to their skin. 3, sunscreen does not help prevent skin cancer. Or 4, the higher the number of the sunscreen, the more it blocks the UV rays. Okay, guys, and the correct answer is 4. The higher the number of that sunscreen, the more that it blocks UV rays. That's absolutely correct. Now, let's look at the wrong answer choices. 1, sunscreen is only, what did I teach you about that word only? Be very careful with those answer choices that use that word only. When they're using all-inclusive, such as only, always, never, choose that answer only if you know beyond a shadow of a doubt that that's the answer. But if you have a doubt, don't choose that as the answer, okay? Let's look at this. It says sunscreen is only needed during the hottest hours of the day. Excuse me? Absolutely not true, because even on a cloudy day, those UV rays from the sun, they go through the clouds. So absolutely, even on a cloudy day, if you're going to be exposed, you're going to be outside, you need to put on sunscreen. So that's wrong. Choice 2, toddlers should not have sunscreen applied to their skin. Excuse me. If that toddler is going to be outdoors, absolutely, they do need sunscreen applied to the skin. If they're 6 months of age or older and they're going to be outdoors, they need to have sunscreen on. Choice 3, sunscreen does not. Really? Sunscreen does not prevent skin cancer. So we know that it does not help prevent skin cancer. We know that's wrong. So 4 is the correct answer. All right, next question. The client comes to the emergency department complaining of pain in the left the left lower leg following a puncture wound from a nail in a board. The left lower leg is reddened with streaks, edematous, and hot to touch, and the client has a temperature of 100.8. Which condition would the nurse suspect the client is experiencing? 1, cellulitis. 2, Lyme disease. 3, impetigo. Or 4, DVT, deep vein thrombosis. And guys, the correct answer is 1, cellulitis. So guys, cellulitis is infection of that subcutaneous tissue. How did the patient get the infection? From the nail that went through their leg, right? So it was a nail that had pathogens and bacteria on the nail. Once it punctured that skin, it caused infection in that patient's subcutaneous tissue. If you look at the question, reddened streaks, edematous, hot to touch, and they let us know that the patient was pierced with a nail. So you're going to suspect a cellulitis out of the choices given. Now let's look at the wrong answer choices. 2, Lyme's disease. With Lyme's disease, guys, first of all, Lyme's disease is caused by ticks, like deer ticks. They carry Lyme's disease. And what you would see in Lyme's disease was what we call a bullseye rash, or a rash that looks like the target sign. You know the target sign, that bullseye? That's the type of rash that you would see. That's what it would look like. Choice 3, impetigo. Impetigo is a bacterial infection. But impetigo is not caused by being pierced with an object, okay? Impetigo is not caused by being pierced with an object. Impetigo is very contagious. We see impetigo a lot in children because what? They love sharing their germs, right? They love sharing their germs. So we see that in a lot of children. And there was something else I want to tell you about impetigo. Oh, and the way it looks different. With impetigo, what does it look like? You'll see fluid-filled blisters. Okay, you'll see fluid-filled blisters with impetigo, not the reddened streaks, edematous, and hot to touch or warm to touch. So for this, our correct answer is 1, cellulitis. Next question. The client diagnosed with stage 4 infected the client diagnosed with stage 4 infected pressure ulcers on the coccyx is scheduled for a fecal diversion operation. The nurse knows that the client's teaching has been effective when the client makes which statement? 1, the surgery will create a skin flap to cover my wounds. 2, the surgery will get all the old black tissue out of my wound so it can heal. 3, the surgery is important to allow oxygen to get to the tissue for healing to occur. Or 4, stool will come out of an opening in my abdomen so it won't get in the sore. And guys, the correct answer is 4. And if you look in the question, it says it that the patient's getting what? Let me see the name of it. Fecal diversion. Fecal matter stool. So if that stool is being diverted somewhere else, instead of coming out of your rectum, it's going to be coming out somewhere else. And the reason they do this, guys, look at where that pressure ulcer is. It's in the coccyx. So they want to make sure that when the patient has these bowel movements, that the bacteria that's in the stool doesn't get in the wound. You think that wound's ever going to heal? No, as a matter of fact, it's going to get worse. Right? So that's why they're doing it in this situation. And that's exactly what it is. It's an opening in the abdomen. And that's where that stool is going to be coming out of that pouch in the abdomen. So the correct answer is number 4. The school nurse is preparing to teach a health promotion class to high school seniors. Which information regarding self-care should be included in the teaching? 1, wear sunscreen with a protection factor of 10 or less when in the sun. 2, try to stay out of the sun between 3 and 5 daily. 3, perform a thorough skin check monthly. 4, remember caps and long sleeves do not help prevent skin cancer. And guys, the correct answer is 3, perform a thorough skin check monthly. Again, you're looking for any new lesions that you are not born with, okay? That now you see on your skin. You're going to be checking those A, B, C, and what? D. You're going to be checking for asymmetry. You're going to be checking the border to see if it's irregular. You're going to be checking the color, and you're going to be checking the diameter of the lesion. So that is the correct answer. Now let's look at our wrong answer choices. 1, wear sunscreen with a protection factor of 10. No, it needs to be 15 or more, not 10 or less. So that's wrong. 2, stay out of the sun between. Notice it said 0300 and 0500. That's 3 o'clock in the morning and 5 o'clock in the morning. The hottest time of the day where the sun rays will hit the hardest is actually 3 in the afternoon to 5 in the afternoon. That's when you're going to tell them to stay out of the sun. Don't forget your military time, guys. So that's wrong. And then 4, remember caps and long sleeves do not help prevent skin cancer. Are you crazy? No, they absolutely do help prevent skin cancer because they help prevent the absorption of the UV rays that are coming from the sun, okay? So 3 is the correct answer. The female client admitted for an unrelated diagnosis asked a nurse to check her back because it itches all the time in that one spot. When the nurse assesses the client's back, the nurse notes an irregular shaped lesion with some scabbed over areas surrounding the lesion. What action should the nurse take first? 1, notify the doctor to check the lesion on rounds. 2, measure the lesion and note the color. 3, apply lotion around the lesion. Or 4, instruct the client to make sure the doctor checks the lesion. And guys, the correct answer is 2. You want to measure it and note the color. Again, A, B, C, D. You're looking to see if it's symmetrical or asymmetrical. If it's asymmetrical, that's bad. B, you're looking at the border. Is it regular or irregular? Irregular is bad. C, you're looking for the color. Is it uniform or dark brown, or is it very light? That very light is bad. D, diameter, you're looking for less, you want it to be less than 4 millimeters. More than 4 millimeters, bad, okay? So you're gonna be looking at the A, B, C, Ds, very important when it comes to skin cancer. Excuse me. Next question. The nurse is caring for clients in an outpatient surgery clinic. Which client should be assessed first? 1, the client scheduled for a skin biopsy who's crying. 2, the client who had surgery 3 hours ago and sleeping. 3, the client who needs to avoid before discharge. Or 4, the client who has received discharge instructions and is ready to go home. And guys, the correct answer is number 1, that client who's crying. Usually, psychosocial is not the client we're going to be running to, because usually when we're giving questions, our choices is going to include someone who has something physiological happening, something that could possibly kill them. That's who we're going to be running to. But in this circumstance, if you look at your other choices, there is nothing physiologically happening to the patient that could kill them. So our priority is going to be the patient that's crying, because they're the only one with something wrong with them. Okay. But just so you know, usually when you get a question about who's priority, guys, I'm sorry, whenever I come into my studio, my nose starts running. I have no idea what it is that I'm allergic to in here. But anyway, normally when you get a question about priority, it's not going to be a psychosocial issue. It's not going to be teaching. It's not going to be someone that's crying. It's going to be someone that something's going on with their blood pressure, or they have a change in level of consciousness, or they're bleeding out. Something that can threaten their physiological status, okay? Which client is at greatest risk for development of skin cancer? 1, the African-American male who lives in the Northeast. 2, the elderly Hispanic female who moved from Mexico as a child. 3, the client who has a family history of basal cell carcinoma. Or 4, the client with fair complexion who cannot get a tan. Before I tell you what the answer is, I hope that you automatically eliminated number 1 and number 2. Number 1, the African American. Look at all this beautiful melanin I have going on. Guess what? That protects me, okay? It really helps protect me from absorbing that UV light and getting skin cancer, right? So number 1 is out. Any patient, when it comes to skin cancer, the person who's going to be most at risk is going to be the person who has the least amount of melanin. So I just gave you a hint of what your answer is going to be. So it's not going to be number 1. And then when you look at number 2, choice number 2 was, where was I? The elderly Hispanic female from where? Mexico. Mexico is hot as hell. So guess what? They got melanin too. They got melanin, okay? The African Americans got melanin. The Mexicans got melanin too. So it's not going to be them. Let's keep it moving. Choice number 3. Now, this is where we're going to get iffy, because it says the client who has a family history of basal cell carcinoma. And we know that risk factors for skin cancer, one of the risk factors is genetics, right? So that's going to be one of our choices. But then let's keep going. The client with fair complexion who cannot get a tan. If you have to choose between that client that has a family member and that client that has decreased melanin, their melanin is so decreased they can't even get a tan, it's going to be that client, the decreased melanin. Okay, so our correct answer, guys, is going to be choice number 4, because this patient has the least amount of melanin out of the choices that we were given. Next question. The middle-aged client has had 2 lesions diagnosed as basal cell carcinoma removed. Which discharge instruction should the nurse include? 1, teach the client that there is no more risk for cancer. 2, refer the client to a prosthesis specialist for a prosthesis. 3, instruct the client how to apply sunscreen to the area. Or 4, demonstrate care of the surgical site. And guys, the correct answer is 4, demonstrate care of the surgical site. Why? We don't want it to get infected. They just had surgery to that area. And guys, what did I teach you about patients who have surgery? And I don't care what kind of surgery it is. I don't care if it's surgery to remove cancer. I don't care if it's surgery for amputation. I don't care. Surgery, we have 3 concerns: hemorrhage, DVT, pulmonary embolism, and what? Infection. So our correct answer is number 4. We're going to teach them how to clean the site, how to change the dressing, because we don't want it to get infected. All right. Now let's look at our wrong answer choices. 1, teach them that there's no more risk for cancer. That's false. There is still risk for cancer. As a matter of fact, this patient who's had cancer before, the cancer can do what? Come back, right? So that's false. 2, refer the client to a prosthesis specialist for a prosthesis. Why? What do they need the prosthesis for? They got basal carcinoma removed. This is skin cancer, so that's wrong. Choice 3, instruct the client. You mean to tell me you would teach the client to put sunscreen on a wound, on an open wound? You're going to have that client walk around a hot mess. Absolutely not. The only thing that client's going to put on the wound is medication if the physician orders it. So that is absolutely wrong. So our correct answer is teach them how to care for the surgical site. The nurse is caring for a client diagnosed with squamous cell skin cancer and writes a psychosocial problem of fear. Which nursing intervention should be included in the plan of care? 1, explain to the client the fears are unfounded. 2, encourage the client to verbalize feelings about being afraid. 3, have the client discuss the client's fear with the client. Have the doctor discuss the client's fear with the client. Or 4, instruct the client regarding all planned procedures. And guys, the correct answer is 2. You're going to encourage the client. I'm still so not used to calling them clients. I'm about to show you my age, guys. I call them patients. That's how I went to school. They were called patients. I'm still trying to wrap my mind around this, calling them clients. But you have to encourage a client to express their feelings. Because let me tell you something. How are you going to know what the patient is even fearful of if they don't tell you? How will you know what teaching you have to do with the patient if you don't give them a chance to express how they feel and what they're thinking? Because while that client is talking, you're listening. And then you can hear if they say something that's completely unfounded. They saw something, Dr. Google, they saw something on Google or they heard something and, they're freaking out for no reason. When they're talking and you're listening, you're also listening to see where their mind is, what they're thinking. So what you know what to correct. And you can alleviate their fears, right? But you have to give them a chance to express themselves. So you always want to use therapeutic communication and use open-ended questions to allow that patient a chance to express their feelings. The client comes to the clinic complaining of a sudden onset of high fever, chills, and a headache. The nurse assesses a patchy macular rash on the trunk and a circular type of rash that looks like an insect bite. Which question would be most appropriate for the nurse to ask during the interview? 1, do you own dogs that stay in the yard? 2, have you been working in your garden lately? 3, have you been deer hunting in the last week? Or 4, do you use sunscreen when you are outside? And guys, the correct answer is 3, have you been deer hunting in the last week? What are we thinking about? Lyme's disease. Right? We're thinking that maybe they got bitten by the ticks that are on the deer, right? Because if you go back to the question, look what it says, a circular rash, like the target sign, like the bullseye, a circular rash that looks like an insect bite, like a tick. All right. So let's look at our wrong answer choices. 1, do you own dogs that stay in the yard? Well, dogs do have ticks, but dog ticks don't carry Lyme disease. Choice 2, have you been working in your garden lately? How do you get deer ticks in the garden? No. And choice 4, do you wear sunscreen when you're outside? What does that have to do with us thinking this patient's got Lyme disease because of that what? Bullseye, that target looking rash, that circular looking rash. We're going to be thinking that they were bit by, a deer tick and possibly a Lyme's disease. So you're going to ask them if, they've been, deer hunting. And somewhere else for when it comes to nursing questions and Lyme's disease, another one is, you're going to teach the patients when you're teaching them how to prevent Lyme's disease. If they have to go through, what are those things called? The really tall grass. I don't know what they're called, guys. But like where the really tall grass is, if they have to go through an area clearing where there's like a lot of grass, very tall, make sure They wear long pants. They have long socks. So they're going to put their socks all the way up to their knees, then have long pants, long sleeve shirts, big rimmed hat to protect their skin, because ticks also like to live in like that brush, that type of area as well. So you're going to, or patients, people who like to go hiking. I'm not a nature person, so I don't know, but the people who like to do those type of things, go hiking and go to the areas where there'll be, lots of grass where those ticks can hide and possibly get on the patient's skin and bite them. You're going to tell them to protect their skin by keeping their skin covered so the ticks can't get to them. Okay, guys, next question. The client's admitted to the medical floor diagnosed with cellulitis of the left arm. Which assessment data would warrant immediate intervention by the nurse? 1, the client has bilaterally weak radial pulses. 2, the client's able to move the left fingers. 3, the client has CRT less than 3 seconds. What is CRT? Capillary refill time. Okay. So the client has capillary refill time less than 3 seconds. Or 4, the client's unable to remove their wedding ring. And guys, the correct answer is 4. They're unable to remove their wedding ring. Why? I want you to go back to the question. It says the patient's got what? Cellulitis. What did I tell you cellulitis is? It's infection of the subcutaneous tissue, right? So they got cellulitis of the left arm. What would be worried? Why would be worried that they're unable to remove their wedding ring? Why would they be unable to remove their wedding ring? Edema. Edema. That infection has caused that arm to get swollen, that hand to get swollen so much that the patient can't remove the wedding ring. So what do you think that wedding ring has now turned into? A tourniquet. A tourniquet that will impede circulation, right? And if that circulation is impeded long enough, guess what's going to happen? Chop. Yeah, the extremity is going to have to get cut off, right? So we're going to be running to that patient first. And look how they try to trick you. Look at 1, the client has bilateral, you're thinking weak radial pulses, but number 1, it's bilateral, so it's on both sides. And 2, they're weak. That's not good, but they're still there. They're just weak, right? So between the patient who's got 2 pulses, they're weak, but they've got 2 pulses, and the other patient who has decreased circulation. Why? Because their arm is so swollen. Now their ring has basically turned into a tourniquet. Who are you going to be running to first? That patient who has a tourniquet as a ring. Why? You have to resolve that circulation. You have to get that taken care of. That's going to be your priority. Then you'll go to a person who has that bilateral weak radial pulses. But your priority is going to be number 4. Okay, guys. And we are down to our last question. The nurse writes the client problem of acute pain and itching secondary to bacterial skin lesions. Which intervention should be included in the care plan? Select all that applies. Guys, how do we treat select all that applies? As true or false? Very good. Let's go. 1, keep humidity less than 20%. That is false. You want the humidity high. You want the humidity about 60%. That's going to help decrease the dryness so they won't be what? As itchy. So that's false. 2, maintain a cool environment. Absolutely. That cool environment will help prevent that itchiness. Number 3, use mild soap for sensitive skin. Absolutely. We want to use mild soap. We don't want to use anything with dyes or with fragrances. Why? Because it's irritating to the skin. 4, keep the lesions covered at all time. No, we don't want to keep the lesions covered at all time. We want the lesions open to air. Okay, we want it open to air, and it helps it heal faster. We don't want to keep it covered at all times. That's false. And by the way, covered at what? All times. All, always, never, only. Stay away from all inclusives unless you know beyond a shadow of a doubt that that's your answer. I keep telling you guys, okay. Lastly, apply skin lotion after bathing. Absolutely. Why? You want that skin to be moisturized, because when the skin's dry, what's the patient what are they going to want to do? Scratch. Okay. So the correct answer is 2, 3, and 5. And guys, that is it for the segment. You guys have been telling me you want skin. I'm going to make sure I keep more coming. But guys, My list of your requests are so long. I don't know when's the next time I'm going to get to skin, but I made sure I at least got you a part 2 to hold you over for a while. Please, guys, if you enjoy my videos, if you enjoy what I'm doing, please let me know in the comments if there's anything that you'd like to see me cover more of. Or if there's anything I haven't covered yet. I feel like I covered everything, but if there's something I haven't covered yet that you want to see me cover, please let me know in the comments. Excuse me. Guys, please don't forget, I am now on TikTok. I'm on Instagram. Follow me on TikTok and Instagram, Nexus Nursing. And by the way, guys, the content that I have on TikTok is different than what I have here on YouTube. So if you're on the go and you want to do some quick studying, hit me up on TikTok. I got lots of videos for you. Please help me grow, guys. I'm really trying to do this for you full time, but I cannot do that without your support. So I'm asking you, please share my content with anybody you know who would benefit from it. Please don't forget to like and subscribe. Please help me grow, and I'll see you guys next time on my next video.